Welcome to Living Transplant,
the podcast that takes you behind the scenes of the transplant program at Toronto General Hospital
and brings you open and honest conversations about the transplant experience.
My name is Courtney, and I'm the Communications Specialist for the Centre for Living Organ Donation.
And my name is Brittany. I'm a bedside nurse in the Ajmera Transplant Centre.
Full disclosure, we are not physicians.
No, and we are not here to give you medical advice.
Think of us like your guides through the world of transplant as we know it.
Whether transplant is your past, present, or future, your passion, or your curiosity,
Living Transplant will show you the world of transplant like you've never seen it before. Welcome back to Living Transplant. It feels like it's been a little while. I hope everyone had a great long weekend. So today we're releasing our second live episode, which was recorded last week, I guess May 19th, with a group of incredible speakers from across the transplant program. Britt and I were joined by Joanne Zee, Senior Clinical Director of the Transplant Program, Cynthia Tsien, Transplant Hepatologist, Blayne Sayed, Liver Transplant Surgeon, and Kathryn Tinckam, Nephrologist and UHN's first female Physician-in-Chief. So a really great group of people. We got to sit down and chat with them about their career journey to the transplant program, how they discovered their passion for transplant, advice they would offer to individuals who are looking to pursue a career in transplant, that kind of thing. So this session, which was called Explore a Career in Transplantation, was part 2 of our virtual open house, which took place on May 19th, as I said, over YouTube Live. So part 1 was transplant innovation with Anna Kovalenka, transplant nephrologist, Marcelo Saipel, surgical director of the lung transplant program, Mamatha Bhatt, transplant hepatologist, and Istvan Mucci, transplant nephrologist. So you can watch the full open house on the Ajmera Transplant Centre's YouTube channel. So that'll be both events back to back. If you're just interested in the recording of the careers section, that's just about 1 hour into the recording. And we'll put the link for that recording in the show notes. As you've probably definitely noticed, Brittany is not with me today, but don't worry, she's in the episode, in the interview, and you will hear her voice shortly. So sit back, relax, and enjoy the live recording.
Good evening and welcome to Explore a Career in Transplantation, part 2 of the Ajmera Transplant Center's virtual open house. My name is Brittany Cole, and I'm a post-transplant coordinator in the Liver Transplant Program. And I also host the Living Transplant podcast, which is the Transplant Center's podcast. I'll be moderating tonight's session along with my co-host from Living Transplant, Courtney Mart. Hi, Courtney.
Hi, Brittany. And hello, everyone. My name is Courtney Mart. I'm the Communications Specialist for the Center for Living Organ Donation, and as Brittany said, the co-host for the podcast Living Transplant. Tonight, we're joined by a very exciting group of speakers, and I'll give them a chance to introduce themselves, starting with Joanne.
Hi, I'm Joanne Zee. I'm the Senior Clinical Director for the Ajmera Transplant Program.
Thanks, Joanne. It's nice to see you. Cynthia, did you want to go next?
Hi, my name is Cynthia Sand. I'm a liver specialist who takes care of patients before and after liver transplantation. I'm also the education director, and it's my job to provide a great educational experience to all of the learners at the Ajmera Transplant Centre. And I actually just moved here from Ottawa about 2 months ago, and I'm really excited to join the team.
Hey, we're glad to have you. Blayne.
Hey everybody, my name is Vladimir Syed. I'm a liver transplant surgeon. I work both on the adult side at Toronto General Hospital, as well as serving as the surgical director of our pediatric liver transplant program at Sick Kids Hospital.
Thanks, good to see you. And Kathryn.
Hi there, my name is Kathryn Tinckam. I'm a kidney transplant physician, and I'm also a laboratory medicine physician with a specialty in the HLA lab, which is the lab where we determine all the organ matching. And more recently, I'm actually now the physician-in-chief at University Health Network.
And belated congratulations on that. So a big thank you to everyone for joining us tonight. We're really looking forward to the conversation. So let's jump right in. We'll start with Brittany. Brittany, how did you end up at the Ajmera Transplant Center?
Well, it's kind of funny. I first started off as a nurse when I was in medicine, and about a year into that, the CEO decided to change our floor. And I kind of just rolled with the punches that way and was like, oh, okay. I had to be quite blunt. I had no general interest or any knowledge really on the transplant program or anything to do with transplant. They don't really get taught that in nursing school, unfortunately. So I kind of just went with it. And ever since then, I'm now about almost 7 years into my career. And every single year since I've been in the transplant program, I've been given a new opportunity, which just pushed me to every limits that I never thought I would ever get to in my nursing career. So I kind of just like, I think like most people, I kind of just fell into it, to be honest, and have never left.
Yeah, for me, kind of similar in terms of how I came into it. As I say on the podcast all the time, I do not have a medical or a science background at all. I have a master's in English Lit and a postgraduate certificate in public relations and corporate communications. So it was through that program that I happened to get, I applied for the internship at UHN at the Center for Living Organ Donation. And yeah, the rest is history. I definitely didn't think that as a English Lit student, I would be working at Toronto General in transplant, but it was a happy accident. And yeah, I'm going to stick around for as long as I can.
And what's your favorite part about the transplant program, Courtney?
Oh, I mean, as someone who's interested in stories, I think the stories in transplant, I'm obviously super biased, but I think they are the best stories, which is what I love about the podcast so much, is that we get to invite people to share their stories. And what I love about my job in general is I get to just share the happy stories from transplant.
That's amazing. So, Cynthia, first off, congratulations on joining the liver transplant team and also taking the role as the education director for the Ajmera Transplant Centre. So, how did you end up in transplant and hepatology?
So when I went into medicine, I actually really did not have a clear idea of where I wanted to end up. I just had this general idea that I wanted to help people. And so when I went through med school, I think you just start seeing like what you're good at, what you enjoy. And what I really enjoyed was hepatology. So, like the study of liver disease.
Mm-hmm.
And then, as part of hepatology, you do some training in transplant. And prior, my experience had been taking care of people with very bad liver disease. So, really, like very end stage, very sick, like they end up in the hospital quite a bit. And then I did transplant, and it was really, really gratifying because you see people getting these liver transplants and then they're completely different. Like they're completely new, different people from those people that, like, maybe 3 months ago were literally like dying in the hospital. So I really enjoyed that aspect of transplantation. And I really enjoyed the research part of it, like being at a world-class institution like this, because I think I'm a little bit ADHD in that I really love doing a lot of different things. I like keeping busy. And so I have the opportunity to do clinical work and take care of patients and do some research, do education, have leadership roles. Like it's really never boring. And working with these patients is so rewarding that I really love being in this job.
So you really had no clear idea, like when you graduated high school, that you were going to go into hepatology. It wasn't
I
like,
had no idea at all.
yeah. I think it's especially in liver transplant. See, it's like night and day. For some, once they get their transplant, you're like, wow, that's absolutely incredible. Right. And so, Joanne, what was your path to transplant?
Well, when I was born, no, I'm just kidding. We'll start from the very beginning. I think I was always really attracted to helping others. And so my training, my background is actually a physiotherapist. And I kind of knew I wanted to help others. Even when I was young, I would be the person, helping someone who was in a cane or a walker across the street, knowing the lights was going to turn yellow soon. So I think I was always attracted to that. But with my physiotherapy background, I always kind of stumbled into leadership, similar to you, Brittany, kind of a coordinator type of role. And then I really enjoyed helping others grow. And I think of being in healthcare, we're always educators. So like learning and teaching. And so I fell into being a manager, which is really like a coach, right? You want to help people be the best that they can be and really work towards a common goal. And that's for helping others be better. And so after being a manager, I went on to be a director, and that was more around looking at system changes, right? So how can I make a difference not only at the local level, but more at a systems change level? And then I went and did my master's in quality improvement and patient safety because I wanted to really formalize, the knowledge around how to make change and make change stick and be effective. And so that kind of led me to be, a better director. But also I was a rehab director over at Toronto Rehab. And we did also some with our CEO, just really looking at how it's really important for our leaders to understand the entire health system. So being in rehab, had the opportunity to join the Ajmera Transplant Centre, which, was a privilege and honor. And it's been remarkable working with this team and just really spearheading supporting the change.
That's incredible. So you went from, do you miss physio at all?
You know what? I do miss the clinical piece in terms of there's very direct gratification as being a frontline clinician, right? You see the impact you're having on the patient day to day. I do miss that, but I think indirectly when I can help support teams moving forward in innovation, I have a different impact.
Yeah. Definitely being in the front line is very tangible versus when you're working in a clinical, in a director role, you get to help a broader spectrum of people. That's amazing.
Mm-hmm. Yeah, that's a cool way to think of it too. Can you tell us a bit more about your role as clinical director, just for the audience?
Yeah, it's an operational leadership position. So all the clinical nurse managers report into my portfolio, but it's really looking at, I would say my passion is quality and safety. So just enabling our teams to be able to do the work that they do best, trying to remove barriers. There is a business component to it. So there's financial aspects, human resources. But I would say the ultimate piece is around improving our patient outcomes and experience.
Awesome. So Kathryn, how did you get started in medicine and nephrology? And was transplant always the end goal for you?
I was one of those high school students who always wanted to go to medical school, but I had no idea what I wanted to do within it. And when I started going through all my rotations, I was the one who was like, oh my gosh, I love pediatrics. Maybe I'll do that. Oh, wait a second. I love surgery. Maybe I'll do that. Oh, wait. OBGYN. I'm going to do that. Like I actually just genuinely loved the practice of medicine. And I found it, so exciting and so wonderful that I was fully undifferentiated. So I did what a lot of undifferentiated people do. And I went into internal medicine, which still gave me all of the scope of cardiology and hepatology and gastroenterology and endocrinology and all of those things. And then in internal medicine, I started being like, oh, I really like cardiology. Wait, I really like endocrinology. But then when I hit nephrology, you have this moment where you realize, oh my gosh, this is it. Part of it is I'm a total math nerd, and nephrology is a very mathematical specialty. But even within nephrology, there's so many different aspects. And I think I was just really fortunate that I had amazing mentorship who happened to also be involved in transplant. And then I was very fortuitous, a lot of happy accidents. I got invited to go work or do some research in one of the laboratories, which turned out to be the HLA laboratory, which is where they do all the organ matching. And I got really interested in that. And I think that was really where I sort of saw the capacity to sort of merge nephrology and transplant and the laboratory. And I went on to I trained in Winnipeg originally, then I went to Vancouver where I did nephrology training, then transplant. Then I went to Boston, which is where I did the lab stuff, and then kind of pulled that all together into a job in Boston for a while, and then got recruited back to Toronto to do both nephrology, transplant, and the laboratory piece, the HLA piece. So it's really fantastic. Like one of the things I think that is great about transplant is you still have to be a really good generalist in order to be a transplant doc. So although you have a lot of specialty in one particular area, like in Cynthia's case, liver transplant, or in mine, kidney transplant, you still have to be a really good general doctor. And I really love that part of it. I love the fact that we look after all of our patients, regardless of what problem they come in with, even if it's not necessarily a transplant related problem. And I love that aspect of the clinical care. I love how broad it is, how it really allows us to be, really comprehensive in our care of patients. And I really love the team. Like transplant is interesting in that I get to interact with my liver transplant colleagues and my heart transplant colleagues and our surgeons like on a regular basis. And we have such an amazing multidisciplinary team, from our ward nurses to our clinical coordinators and our nurse practitioners. It feels like it really is an incredible team, and you feel like you're part of something amazing. And not only do you get to do all this very rewarding work looking after patients, you get to go to work and really enjoy hanging out with your colleagues, because all of you are kind of focused on the same thing and you have the same motivation and the same optimism. And that is just such a fantastic way to spend every day.
Absolutely. I mean, that's the dream for everyone, right? Is to just love your job. So
Yeah.
You were talking a lot about mentorship and how important that was to you. Are there any mentors that really stood out to you along the way?
You know what? I've been super fortunate to have both great mentors and great sponsors. And I think you need both, and you need to be both for other people. So mentors, give you really great advice, and they give you great advice in certain aspects of your career, like the clinical aspect or the research aspect, or how to be a good teacher. And then I've been really lucky that I've had great sponsors who are the people who, when they hear about an opportunity, they say, hey, have you thought about this person? And you get to move forward that way. And I think one of the things I love now, so I just finished last year doing an MBA, so you can go back to school really late and do these things, although I have to say pulling an all-nighter at this age is a lot harder. But one of the things I really want to think about now that I'm in the position to do so is, how do I return the favor? And how do I not just give advice to people, because sometimes free advice is worth what you pay for it, but how do I see opportunities and look at people and say, hey, you should think about this person for this opportunity, and help other people have those same connections that I've benefited from in the past.
That's
Absolutely
fantastic.
amazing.
Yeah. Blayne, what about you? When did you decide that you wanted to be a surgeon, and how did you bring that to fruition?
Like, I'm always following Dr. Tinkham, which is not good. Because every time you speak, I'm like, that's it, right? I was actually very similar to actually what Dr. Tinkham was describing, in terms of, in medical school, really enjoyed everything that I did. In every rotation that I went on, I thought I was going to be a neurologist or a psychiatrist, and I did an MD PhD, and I had done my PhD in immunology. So before I did any of my clinical work, really, I'd already had my basic science background. And when I hit my surgical rotation, I really enjoyed it. I had a very skewed perception of what surgeons were and how they functioned. And the tradition that I was exposed to, actually, they were, in essence, thought of themselves as internists, as medical doctors who cut. And I really like that in terms of people who are really kind of very well-rounded physicians. And that really appealed to me in my sense of what medicine should look like. My father's a family physician, so that always inspired me. I grew up kind of tagging along in clinic and rounds. And so I really learned everything I know about interaction with my colleagues and with patients from my dad. And so surgery appealed to me. It just clicked for me. In terms of transplant, transplant to me, it was really the science that drove me there, right? Like, transplant was the field where I felt like science was part and parcel. You couldn't be a transplant surgeon without being interested in science. And so really the science pushed me there. The other thing that I found to be very motivating, and I've heard one of my mentors speak about this, it is in some ways a uniquely and profoundly optimistic field, right? Like, our whole field starts with the idea that someone says, I'm going to do something good for somebody else. Like, there is nothing that we can do as physicians and healthcare providers without someone first making an altruistic statement, an altruistic intention to help somebody else. And it's such a unique field, and that really spoke to me and really inspired me. And I always just found that so profoundly moving within our field, that basically we wake up every day and we start our day with someone has done something good for somebody else, and that's allowed us to help another person. And I still, to this day, very much am inspired by that. When I figured out that I wanted to do transplant, liver is what really interested me. And I've been privileged enough to take care of both adult and pediatric patients. And, really with a world-class group at both at UHN and at Sick Kids. So I feel very privileged in that regard.
Everything you just said pretty much sums up why I love being able to, it's such a privilege to be able to share the stories of transplant, because they're so incredible and life-changing. You just touched on a bit how you are at Toronto General and Sick Kids. Can you explain that a little bit more?
Sure. So we have obviously transplant programs at both places. And historically, there's always been a very close coordination between the Toronto General Liver Transplant Program and the Sick Kids Liver Transplant Program. In essence, a really kind of a hybrid program. A big part of what we do for our pediatric patients depends on our living donor program. And that's those living donors make their donations. The surgeries are at Toronto General. So there's always been a close coordination of surgeons between Toronto General and Sick Kids. And so I was fortunate enough to be trained by Dr. David Grant right before he retired. And he had always had a big footprint at both hospitals. And as many people said, it's better to be lucky than good. And so I just happened to be in the right place at the right time to really, and Dr. Grant helped groom me for that role. And so basically I do in some small part of what he was doing in serving as both the surgical lead for the pediatric liver transplant program at Sick Kids and being part of the liver transplant program, the live donor program at Toronto General.
Yeah, the transplant program is very energizing. And I honestly feel like after every single one of your stories, I feel like I can relate to almost every single one of them. Like Kathryn, you said you were like OBGYN or pediatrics. I always wanted to do something like that. And then transplant just like, I was so intrigued by it. So it's very clear that there's obviously not just one way to get into the transplant program. There's so many avenues that we can all run down. So we're going to move on to our Slido for now. Did I say it right? Slido. It's Slido, right? Okay.
Yes.
I wasn't sure. And now for our live Q&A. And so...
Yeah, let me just pull this up. So we'll just start with one of the questions I remember. Oh, here it is. Yeah. We'll just start with this one. If you had to start your career over, what would you change? So as Brittany said, there's no one way to get into transplant. So if you knew this, where you were headed, I guess, is there anything you would change? Would you change anything? Joanne, let's start with you.
Oh, I think the right answer is I probably would have liked to start transplant earlier in my career. I think, our decision around ensuring that leaders are well-rounded to fully understand the system, I think it starts off with, when you think of the very, very sick and the acute, I think you get such an amazing understanding and appreciation of everything that's done. And I think Blayne said it right. Like, I wake up every morning knowing that it's starting with the generosity of someone that's given a gift of life to another person. And I think that satisfaction and that responsibility that I have as one of the leaders of the program, I get to work with amazing people. So I think starting my career over, I probably would have wanted to come to transplant earlier in my career.
Right. Okay. So it sounds like transplant is really where you want to stay. Hopefully we get to keep you.
Yeah.
What about you, Cynthia?
No, I don't think I would make any changes. I think I took a little bit of a circuitous route myself, but it was a great experience. Like everything that I did, I learned from, and, I don't think that you have to be laser focused. I think that everything that you do and that you learn from definitely adds something to the table. And as my colleagues have said, transplant is so diverse and there's so many things that lead to transplant that I don't think you need to necessarily say, oh, from day one, I knew that I wanted to do transplant and that's all I did all the time. I think all the different experiences I had and all the different things I learned have been super helpful to me in my role today.
Yeah, I think it's pretty rare that someone knows exactly what they want to do and they do that thing and it's exactly what they hoped and everything works out. Right. So yeah, Kathryn, unless there's anything you want to add, I assume everyone kind of feels a similar way that they feel well-rounded based on the journey they took to transplant.
Yeah, the only thing it's not that I would change. I love exactly everything that I've done. One of the things that is kind of fun, but also it's a great opportunity and also a little bit scary sometimes in medicine is you have to move around a lot, or you can move around a lot for your training. And when I say move around, I don't mean like different hospitals. I mean different cities, different countries. And the one thing I might change, knowing what I know now, is I would have gone to more different places as part of my training. I was fortunate to actually go to a few, but I think one of the things that I've learned is because I've seen medicine practiced in so many different places already, every time you get to see how it's practiced differently, you learn something else and you bring something even more rich to the environment, and an understanding that there's not just one right way to do thing, and an increased tolerance and a greater appreciation for equity and diversity. So I think the one thing I do is I try to be even a bit braver and do training in a few more places, but I wouldn't change a single thing about what I've done otherwise.
I love that. Blayne, do you have anything to add?
No, I agree with everybody said.
Sorry, I have to stop putting you right after Kathryn. I was putting an earlier request. My bad.
Okay, I'm going to move on to the next one. So, what are the first steps? What are first steps an undergraduate student can take to get involved in the Transplant Center, research, shadowing programs, etc.? Cynthia, maybe you can take this one.
Yeah,
For a
I'd
lead.
love to. I'm very excited that people are interested. We have a fantastic group of people who have already established these fantastic programs, so I can't take credit for that. But I think later on, we're going to show you guys our website where you can basically find information. There's a lot of summer programs, workshops. They're working on a education program. But I think, it's important to know that there's a lot of clinicians in our department who are hiring summer students. There's opportunities for mentorships, co-op students throughout the year. So there are a lot of opportunities to get involved in transplant now. And we're going to show the website where you can find the links to all of these programs during the summer, but also throughout the year.
Okay. How about Kathryn? What are some steps do you think that some
I don't know that I have. You keep putting me after Cynthia. No,
Sorry.
so I don't know that I have that much to add. The other thing I would also say, and this is more of an editorial and personal comment, is that if you think you might want a career in transplant, you don't necessarily have to start doing it undergrad. And I think what you heard from a lot of us is we've all done lots of different things that got us to this path. And I think it's equally important to follow your passion and do things that are interesting, that make you a well-rounded person. Like if I could go back to undergrad now, I would do more anthropology and maybe astronomy. But the point is, I think you also can just do really interesting things to be a part of your community. All of those things matter when you're thinking about any career, including a career in transplant. So it is fantastic that people are excited and want to learn more. But I also don't want people to think that if they don't do these things, that a career in transplant is off the table for them. Because I think you really just have to explore your passion and be a really well-rounded person and care deeply about wanting to help people.
I completely agree. I was about to say that Courtney's a true representation of that, because she didn't start by any means going into the medical field and landed in transplant with a comms degree. So she is granted she's my co-host, so I speak very highly of her, but I do think Courtney is a very well-rounded person and a great person to as a representation of that.
Thanks, Brittany.
No problem.
I wasn't ready for that compliment, but yeah, Kathryn, going back to what you said, I think that's a really good point. Like no profession takes place in a vacuum. We all kind of need to have a sense of the world around us. So Blayne, this next question is absolutely for you. What does a typical day look like for a transplant surgeon?
It's perfect. I can really stretch out with this one here. I don't have to follow, so one of my daughters will come into the bedroom screaming about how they don't have any clean clothes. And then, the day will kind of go from there. I mean, I would say the interesting thing about transplant surgery is there's probably no typical day, which is one of the things that appealed to me. It's more organized than organized chaos, but it's a really different field. So unlike a lot of medical and surgical fields where you have a very distinct schedule, okay, I'm operating on Mondays and Wednesdays from 10 a.m. to 4. It's not like that. You're on call. And so, for instance, if I'm on call for a stretch of time for a week or weekend, basically I'm getting calls about potential organ offers for recipients that we have. I'm evaluating those. I'm taking information in, making decisions about the right offers for the right recipients. I take all those very seriously. So they take a lot of thought. Every offer is a potential life saved. And so we always think about how we can best utilize these organs for patients who are on the wait list. These can happen in the middle of the night. They can happen in the middle of the day. And so it's really kind of it truly is a 24/7 type thing. And then after we accept offers, we get our recipients in, we see them, we talk to them about the surgery that's upcoming, and then we have the surgery itself. Our operating room days can be quite long, and they can start at any hour of the day. The operations may last anywhere from 4 to 5 hours to 8 to 10 hours. I will tell you the time moves really quickly in the operating room. It's rare that you're kind of just counting the minutes. It's always interesting. It's a very kind of busy and interesting, hands-on type experience. And then certainly the best part afterwards, and really before COVID, is then going out to the waiting room, talking to the family who's waiting, telling them everything has gone well, seeing the relief and the joy on their faces, and then rounding the following day and seeing the patients that you've been helping over the last 3 or 4 days. It's really incredibly rewarding. And so I'd say that would be kind of a typical, that would be encapsulated with the typical call week, but it really depends from a day-to-day perspective.
Right, of course. So being on call with that feeling of, they could contact you at any time, how do you find a work-life balance knowing that you could be going into the OR at any moment?
I mean, thankfully we're not on call all the time.
Yeah,
I think it would be a real challenge. My wife will sometimes make me sleep on the couch when things are really busy because it disrupts her sleep. And so that's a work-life balance solution. My kids are pretty funny. And so we have 4 girls. My oldest is 13 and 11, and we have twins who are 8. And I remember once when I was a resident, one of my twins were playing, and one of them was rolling on the floor and saying, I'm coding. And then the other one was pretending to. Gosh. But it's because when I was on call as a resident, you're always getting calls, you're running, they say the patient, so there's really kind of like an intense experience. My kids actually have full understanding in many ways of the level of seriousness of this. And so when I get calls, you don't hear them banging on the door now, they take it really seriously, and they're very invested in it. When they see, their dad in a news article, or if they watch this on YouTube, they're really proud of it. And so I've tried over time, and I'm sure that many of you have had the same experience, I try not to build such a wall between my professional career and my personal career. I want my kids to know when I'm not there, I'm not there for a reason. It's because I'm there to help somebody, and for them to be proud of me for that. It can be hard, obviously from our call and clinical responsibilities, but I think in the end, seeing that pride in their eyes makes it worth it.
Yeah. Oh, I love that. Yeah. It's not so much work-life balance as a healthy work-life integration. I like that.
That's a good way of saying it.
Okay, so I will ask this one. What is your wildest organ transplant story? And I feel like because Blayne went always following Kathryn, we'll go with Kathryn. You're up first.
I have to say, I'm not 100% certain how to answer this question. I sort of feel like, these stories are very unique and very personal to patients and to donor families. And it's not so much that the stories are wild or exciting. I think it's that, I think we've done some incredible things at UHN. So this might not meet the definition of what people are talking about wildest, but one of the things that I think UHN's had a lot of transplant firsts, and maybe that's some of the things that we could focus on. So thinking a little bit, some people may be aware of the kidney paired donation program in Canada, which is quite a phenomenal program where if people have a living donor for a kidney that they're not a match to, there's actually kind of a matching program across the entire country where a donor from Vancouver could give a kidney to someone here in Toronto, and their donor could give to someone in Halifax, and their donor can give to someone in Saskatoon, and so on. And what people may not realize is the very first one of those transplants that ever occurred happened right here at TGH in 2008, I think, February 2008. And actually, we were actually able to create that very first chain through looking at people's matching profiles. And I actually did the matching using Post-it notes on a whiteboard in my office. So I don't know if that's a wild transplant story, but it's still kind of a cool transplant story. And it's sort of the start of how kidney paired donation, that was the very first one of those that we did in Canada. And so when I think about wild organ transplant stories, what I really think about is a lot of the firsts that have happened here. The first lung transplant was done in the world, the successful one. It was done here at UHN. We just finished, I'm going to take Cynthia's line here, but the 1,000th living donor liver transplant was just done here at UHN. These are amazing firsts, and really, I think they're wild. So those are the kinds of things that I like to celebrate. Maybe not anything as dramatic as you might see on Grey's Anatomy, but really, really remarkable. And I think to Blayne's point, highlighting the incredible generosity of donors and donor families, and honestly, the really emphasizing the trust that our patients place in us, which I think is the biggest honor.
I think that was a perfect answer for that question. Speaking of world first, we did an episode on the Transplant podcast with Dr. Levy, and he talks about all of the world firsts that we did at Toronto General, because they are absolutely wild. And you mentioned the paired kidney donation program. And I remember Dr. Cole had mentioned that you were also a big advocate for Courtney, help me out here.
The vouchers?
The voucher system.
Yeah, so I'll be candid. I don't like the term voucher. It sounds far too transactional. So there's a lot of, I think there's just a lot of ways that we now are able to match donors and recipients that we wouldn't even have thought of like 10 or 15 years ago. And so the way I would think about what I think in some parts, like some programs they call a voucher program, I would think about as asynchronous live donation, where someone is able to donate a kidney to sort of the living donor paired exchange pool well in advance of when their intended recipient might actually need that transplant. And the reasons people might want to do that is they might be healthy enough to donate right now, and they're worried that if they're either their family member or their friend who might need a transplant might not need that transplant for 10 or 15 years, that person might not be eligible to donate then. So the whole idea is, how do we start to create asynchronous opportunities to ensure that we still increase living donation and we are able to meet people's desires to donate when it's appropriate for them? This is something right now that is not yet operationalized in Canada. There's a lot of government policy and provincial policy that needs to be managed to do that. But it's not really about either a voucher system or those type of things. It's about how do we continuously look at how we do things and ask if we can do things better from a very patient and donor-centric approach, maintaining our principles of quality and safety and good outcomes, but really reflect the creativity that we can achieve with the changing times.
Yeah, and working with so many world first at UHN, that really is the mindset, Kathryn, that you just illustrated, is that like, how can we increase? How can we make it better? How can we make it smoother? That's one of the great things I think about working in the Transplant Center, for sure. Yeah. Does anyone want to add on with wild or groundbreaking organ transplant stories?
I think that Kathryn summed it up well, but when I look at the profile of anyone joining the transplant team, it's one of curiosity, one who always wants to improve the next step. And I think courage, when you think of, how do you start a paired exchange program? How do you do the first islet transplant, preemptive kidney transplant to prevent ongoing chronic dialysis? You think of all of those world first, like we have ex vivo lung, taking a lung and it's living outside the body before we implant it. All of that is about courage, innovation, and just trying to keep improving what we do every day. So, I think that's why it's so exciting to work in transplant.
Truly I always, whenever we talk about the world's first transplant program, I honestly always feel just like really energized. And I'm like, I just can't wait to go to work tomorrow because I love talking about it. Dr. Levy talked about how he started the program, which is a very interesting story. So I guess hope that answers the wildest organ transplant story question.
Can I piggyback actually off of both Kathryn and Joanne's comments? So I think one of the other things that's interesting is that, from a programmatic standpoint, in terms of the innovation and the courage and the kind of first in Canada, first in the world that we've had, there's an interesting translation on an individual patient-physician relationship. And so I'll tell a story about a young man that I transplanted that Kathryn helped me with quite a bit, who got a liver transplant, and he's father of two kids, the youngest less than 10 years old, and he needed the transplant. He got the transplant. Everything was going great. He looked great. He was walking around, and then his liver just started failing, and we didn't understand what was happening, and it failed really quickly. And I think, it's hard to exactly put into words the relationships that we as healthcare providers, as physicians, as nurses have with our patients in a one-on-one, but you feel so personally invested. And I was beside myself watching this happen because I had done his first transplant. And I came back on call when we had relisted him within a week or so for a new liver. And I came and I had an offer that wasn't a perfectly matched organ, but it was a good organ. I came to Kathryn and I said, I want to put this liver into this gentleman because it's his only shot. We really worked through the risks and the benefits and what we were going to have to do for him to really optimize, to make things work for him. And we did it. And part of that is because we have a history of innovation and understanding what that means, how to manage those situations clinically, and people being brave and courageous, and doing things and pushing the envelope for our patients. he did great afterwards, and he's on Twitter all the time, and it's really, every time I see his face pop up, it makes me smile and sometimes gives me goosebumps. And and so certainly from a programmatic standpoint, it's really amazing, but also on a one-to-one individual physician level, individual nurse to their patient, in the culture of innovation and pushing things in really difficult times and patients who are in dire straits. It's really inspiring, and it really cements this relationship with patients that I think is hard to really put into words sometimes.
Yeah, I mean, I think you kind of answered this next question here. Like, obviously, as you illustrated just by that story, and I know who you're talking about. I see him all the time on Twitter too. I hope he's watching. But yeah, so transplant is a very gratifying experience. We hear that a lot too from living donors as well, that there are kind of emotional benefits of helping someone by being their living donor. But yeah, if there's anything anyone wants to add in terms of rewarding aspects of their job. Cynthia, I know you're new and you kind of illustrated a little bit earlier about what you like about hepatology and seeing the night and day difference with patients. Is there anything you wanted to add on there?
Yeah, I would say that, actually echoing what Kathryn said, is that I've had the benefit of a lot of great mentors during my career as well. And that's actually a really great part of the job, is working with learners. And so for young people who are super enthusiastic, who really want to be there, I feel like it's extremely rewarding to pass on that knowledge and that, what I learned from my mentors, passing that on to another generation and seeing them develop and, know that what you've accomplished and what you achieved, like you can pass on to this next generation that's going to build on it and keep growing. I think that's also extremely gratifying.
Yeah, absolutely. And as a teaching hospital, like that's such a huge part of what we do.
Can I add one thing? Because Blayne just reminded me of something. So it was actually related to that case, but I think it is really critical. Is the transplant team here at UHN is really something quite phenomenal. Even though, we're not always officially on call all the time, there is not a single person who, if you text them at 2 a.m. on a Saturday saying, I've got a difficult case, I need your perspective on this, or I need your lens on this, that they're not going to call you back. And everyone actually just helps each other and a lot of us have become very subspecialized in a lot of areas where we develop a particular expertise in, like there could be surgical experts and there could be certain types of immunology experts and certain types of medical experts. But I think what's really amazing and why I think our patients get such great care is there's no ego in it. It's not like I have to know everything from my patient. I've got this entire team. I'm surrounded by like all these geniuses. And if I have a question, I can just call one of them, or I could just walk down to their office. Well, back before COVID, I could just walk over to their office and just say, like, can I discuss a case with you? Or what would you do here? And what's remarkable is how everyone is genuinely invested in the success of every patient, even if as a kidney physician, like I'm genuinely invested in the success of Blayne's patient. And I think that's actually really rewarding because it means you're part of something bigger than yourself. And there's nothing more gratifying, I think, than that.
I would have to agree. In this new role as a coordinator, a lot of people told me that working with the liver transplant team, especially the nurse coordinators, that they were like, oh, you're going to absolutely love it. The team is amazing. That was the very first things out of their mouth. And I'd have to agree, even to the point of today. I had a patient and will often ask each other from across the cubicle, like, hey, Rox, what's this? Or hey, Jeff, what's this mean? And we all just chime in. And it's not, although it is my patient, it's a team effort because I don't know everything and they don't know everything, but they're all so smart and so specialized. And it's incredible because I'm like, I don't know what I would do without you. Cynthia, I think you're laughing because maybe you've walked in and heard me be like, Shauna, can you help me, please? Please help me with this one. But yeah,
I've done that too.
Yeah, it's especially like with Otter and our system is like, it's hard a learning curve, but the team has been absolutely incredible in being able to help carry each other through this whole thing.
Sorry to interrupt, Brittany. We have a young transplant enthusiast. Hi, okay. Caleb. Does anyone want to tackle this question? Does a transplant hurt? Blayne?
Sure.
Yeah, Blayne.
Hi, Caleb. I'm glad you're watching. Nice to meet you. So I would say yes and no. Depending on what kind of transplant you have, we have to make an incision to put the new organ in. And that incision is usually sore after the transplant, but both at Sick Kids and Toronto General, we have really awesome doctors who really specialize just in helping people's pain afterwards. And so I would say routinely for my patients who are kids after a transplant, they're really feeling better a couple days after surgery. And most of them are kind of up and about without too much pain. So it's usually sore the first couple days, but after that, it goes back to normal pretty quickly. And there's a really great team of doctors and nurses who are really experts in helping you with any of the soreness afterwards and kind of getting you back on your feet.
Thank you.
And maybe if I could interject, a lot of our patients, when you see them after their operations in the hospital, you know that they just had a big operation, a big surgery, but they look so happy. So I think there's definitely, afterwards, they are just really, really happy that they had the surgery. And so I think that helps quite a bit.
That's an important detail.
And they've got their energy back and they're ready to go out and play. So I guess the next question would be, what is the hardest thing about working in transplant? Joanne, you're up.
Oh, I think when I look at, transplant, it is reliant on a gift. And I think about every day, the patients that are waiting on our wait list for a transplant, for an organ, for a match. I think about that a lot every day. And what can we do to help promote people to, donate, think about donation, and really help us boost that. So I think that's, for me, the hardest piece around, knowing that we do have many patients waiting for an organ match and a transplant.
Yeah, I'd have to agree. Kathryn, how about you?
So, I think Blayne's comment about every single day starts with something really optimistic, that someone has done something really positive for someone else. We certainly have a number of living donors in our kidney and our liver program, but we also have a number of deceased donors. And these are individuals who have passed away due to the course of an accident or an illness, and their families have made this incredibly generous decision to donate their organs to try to save someone else's life. And we, like as Blayne said, it can be in the middle of the night or anytime during the day. We'll get these offers, and we learn a little bit, just what we need to know, medically necessary. We learn people's ages and a little bit about their past medical history and what illnesses they might have had, and we get to see their lab results. And through that, we sort of get to know just a little bit of a glimpse about this individual whose family is making this incredibly generous gift. And what I find is I really take some time to reflect on what that family must be going through. And I'm so incredibly admiring of the grace that they are demonstrating in what can only be some of the most painful moments of their lives. And so as I think about that, I'm incredibly grateful for my patients who are going to be getting this gift and are going to be coming well. But it is impossible to do that without having a moment of pause about the sadness that another family is feeling. And we hope that through knowing that they're helping other people, and many of our recipients choose to write letters, anonymous letters to the donor family, I hope they find some peace in that. But I would be lying if I said I didn't have pause every time thinking about this person and this life and what their families might be going through as well, and how to balance that. And the joy that comes from, seeing our patients be healthy is really wonderful. But I think we're all human and we recognize that balance that happens in the process. And I think we have to be mindful and really respectful of it. And I'm incredibly admiring of the grace.
Yeah. Cynthia, how about you? What do you think is the hardest thing?
Yeah, I would have to say it's the fact that, as other people have mentioned, I think everybody in transplant goes into transplant wanting to help other people. And when you can't help everyone, I think that's the hardest thing in transplant.
Mm-hmm. Mm-hmm. Blayne, you probably have a very interesting perspective with sick kids and working at Toronto General. What do you think is the hardest thing?
I mean, I think, Kathryn and Cynthia and Joanne have all touched on really, transplant is in essence a very different and unique field. And there's a great book that's recently written by a transplant surgeon, but called When Death Becomes Life. And that's in essence what transplant is. And so there's no joy without sorrow, certainly from a deceased donor perspective. I think the hard thing honestly about medicine in general is we don't always win. Like we're not always successful. We've all lost patients despite our very best efforts. And despite, trying as hard as we can, and it's hard, and it takes, I think, a personal toll on all of us. I think certainly in the last year and a half, we have certainly seen with our colleagues dealing with this pandemic, how hard it can be in general, taking care of patients and really trying to help people under duress. And certainly in transplant, it's no different in that it doesn't always work. And in some ways, our success is our worst enemy. Transplant is, really, if you think, for instance, you can think about liver transplant 30 years ago, it was, just from a brief standpoint, Tom Starles was one of the surgeons who really started liver transplant. Mm-hmm. His first 3 patients were all children and they all died. Like 2 of them died on the table. 1 of them died immediately afterwards, right? Mm-hmm. The fortitude it took for that group of anesthetists and surgeons and intensivists to keep on, right, in the face of basically abject failure to now, where we have, 1-year survival rates for patients and recipients of 97%, right? Like, so we become, in some ways, we forget sometimes that things can go wrong. We can't always save patients. We can't always get organs for patients. And I think that's the hardest thing, is because we all invest in our patients and we all care very deeply and we want to succeed 100% of the time. It's always hard to feel like you've had a patient who hasn't made it despite your best efforts. And so I never actually, and I hope that never gets easier, to be quite frank. I don't want that ever to become any easier. I want that always to sting. And because I think that's what pushes all of us to do our very best for our patients and try to, do the best we can every day for them.
That was incredibly well said. I'd have to agree. We all have those patients that we do lose, and it lights a little bit of a fire under and makes you keep going. With all of that being said, I think we are coming up to our end of our time. So before we wrap up, I'd like to give Cynthia a chance to share any upcoming opportunities for any students.
Yes. So because I do see there are some questions about like how people can get involved. So we're going to put up a website up there where you can find programs for pretty much every level of learner. So we have programs aimed at students in high school. We have a diversity and transplant outreach program. We have some opportunities for people who are an undergrad, in medical school, residency. So we do have information there about the fellowships that we offer, the transplant research summer program. And also it's important not to forget, there's going to be information there for transplant nursing education, as well as mentoring and outreach. And so I highly encourage you to check out the website, because there's a lot of opportunities. As I mentioned, a lot of our researchers hire summer students. And so there's a lot of opportunities on the website. And I highly encourage you to go there and look for all these opportunities and programs that we have.
Thank you, Cynthia. And thank you everyone for joining us. Really appreciate this great conversation. Thank you to our fantastic speakers. If you're interested in future events, check out GiveLifeUHN.eventbrite.ca. And yeah, we hope to see you next time.
Thanks for listening to this episode of Living Transplant. If you have questions or suggestions for future episodes, email us at livingorgandonation@uhn.ca.
Don't forget to subscribe, rate, and review Living Transplant on iTunes, Spotify, or wherever you listen to podcasts.
And follow us at GiveLifeUHN on Facebook, Twitter, and Instagram.
See you next time.